Hi, Dr. Paula Sauer here. I am here today with another segment of Why Do I Care? Today's topic is posture. Posture. Why do we care about our posture? Well, we're born with a particular skeleton. Our skeleton has certain curves to it. Now, when you're born, you're actually born in a flexed position, in a fetal position. And you stay that way until you start to develop muscles to hold your head up. So you'll see a baby transition to like they're able to sit themselves up and they're able to hold their head up and kind of do these little, tummy time things where they're, lifting their head, looking around and pushing with their arms. What's happening there is that you start to develop muscles around your neck and your shoulders that start to change the curve of your spine. So your primary curves of your spine are your flexed or your kyphotic curves of the spine. Those are the fetal ones. And then as you're moving through that first year of life, you start to hold your head up. You start to develop that cervical lordosis where you're holding your head up on top of your neck. Then as you develop into a toddler and you're holding yourself up, you're standing up, you're beginning to walk, then what happens is the body starts to develop that second lordotic curve in the lumbar spine from standing up and walking. A lot of things in our body are designed the way that they're designed for because we stand up and walk. And anybody who's heard me lecture, if I ask a question, you answer with exactly that answer, I'll be like, yes, you got it. But it's true. So we have different curves to our spine. We have primary and secondary curves. The primary curves being the kyphotic curves of the thoracic spine in the sacral region, and then the secondary curves being the lordotic curves of the cervical spine in your low back. Bet you didn't know it was so complicated, right? But what happens over time and as we're growing and kids and teenagers and we start standing like this or sitting like this or we're on our phones like this, we're starting to go back to this kind of fetal position and our bones are not developed to withstand that unusual wear and tear. The shape of the vertebrae are very specific to hold weight in the body of the vertebrae, but then also in the facet, they're designed to allow for certain movements. So if you accentuate any curve too much one direction or the other, we're going to lose some of that range that it was meant to be there. And then also what happens is you put unusual wear and tear on the bones themselves. So you may have heard of the term degenerative disc disease or spinal stenosis or arthritic condition of the spine. All of this stuff kind of leads to some of the same things, which is if you put unusual wear and tear on any bone in your body, not just in your spine, but any bone in your body, there's something called Wolff's Law. Wolff's Law is if you stress a bone out and you keep stressing it out, it's going to respond with making more bone. Now, this is a concept that we use a lot of the times for people who have osteopenia or osteoporosis, meaning they're getting some bone demineralization. We want to stress the bones out a little bit with exercise and weight-bearing exercises and weightlifting to stress the bone out a little bit so that it rebuilds some of the bone density. That's great. But when we have other things like unusual wear and tear on the spine because we've been sitting like this for 15 years or 40 years or 60 years, then you can see like this is a lot of wear and tear. So the bones themselves, the vertebrae themselves start to lay down extra bone and we start getting bone spurs. We start getting stenosis and narrowing. That's what that means. You'll maybe heard of that before. The narrowing of either where the nerve exits out through the foramen or through the central canal itself where the spinal cord runs through. So these are things that we can avoid over a lifetime if we keep our posture more in check. So why do we care about our posture? Because for the longevity of how long we want to be in our lives and on this planet, maybe close to 100 years. And we want to do that optimally with less pain based on the information we know today. So I would like to encourage you all to take a look at your own posture. look at some of the posture videos we have posted, some of the other videos that help you kind of regain this upright position, some of the core work. And if you're not sure of how to do this for yourself, send me an email and let's talk. Let's go through everything. I'm happy to pick your posture apart and go, you should do this, you should do that, you should do this, set it up like this. This is what physical therapists are really good at doing. If you want to reach out to me, you can. My name is Dr. Paula Sauer. My email address is paula@alignptla.com. It does not matter where you live in the world. We could do telehealth anywhere, anytime, as long as I'm not asleep. But I'm happy to help any of you. So shoot me an email. And if you have any comments or questions, put them down below. I'm happy to address any other concerns or even questions of like, what is this? Why do I get this? I can answer that. A lot of us can answer this for you. So I'll see you all online very soon. I'm looking forward to more of your responses. Thanks so much, everybody. See you soon. Bye-bye.